Are you looking for a better way to keep your eyes white and bright that's doctor approved? Well, today we're going to be talking about Lumify. Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 4 p.m. Hello, Dr. D here. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease, and in my practice, I specialize in dry eye. On this channel, I post educational content about the eyes as well as vision products. If you're new here, please consider subscribing if you like this kind of content, and don't forget to hit the bell so that you never miss one of our videos. All right, while you're watching this video, I've included some helpful show notes for you down below, as well as where to find Lumify. So be sure to check that out as we go along. So today we're going to talk about Lumify, or as I like to call it, magic in a bottle. We're going to go over what it is, why it's different than other redness relieving eye drops, when it's appropriate to use it, and when it might be a better idea to seek treatment and give your eye doctor a call. So before we get started, I wanted to tell you a fun fact about Lumify. I actually love this drop so much that a couple of years ago at Halloween, I decided to dress up as Lumify. I'm going to include a photo somewhere here in the frame. And I wore a purple hat, I made a t-shirt that said Lumify, and I went around with my magic wand just, bestowing clear white eyes on everyone I could find. All right, without further ado, my pupils, it's time to go to eye school, so let's talk Lumify. Lumify is a redness relieving eye drop that came out in 2017. It is made by the company Bausch & Lomb, and it actually comes from a drop that's been on the market for a good long time now. So Lumify is actually derived from one of the glaucoma medications we use. That glaucoma medication is called brimonidine. So brimonidine is in the class of alpha-2 agonist, and that's going to become important later, even though it just sounds like fancy jargon at the moment. Now, the difference between brimonidine and Lumify is that brimonidine is available in 0.1% and 0.15% concentrations. Lumify is in a much, much smaller concentration, 0.025%. That seems to be just enough concentration to reduce the redness and keep your eyes bright and white without causing any of the other effects that brimonidine does, like eye pressure lowering. Okay, so in its higher concentration, brimonidine is used as a glaucoma medication. And it was in fact when we were treating glaucoma patients and noticing that one of the side effects of their treatment was brighter, whiter eyes, that Bausch & Lomb came up with the great idea to offer a lower concentration of brimonidine for the sole purpose of relieving eye redness. All right, so let's talk a little bit about why you would choose Lumify over any of the other redness relieving drops that are on the market. So I mentioned that Lumify is an alpha-2 agonist. Alpha-2 agonist is going to selectively target just the veins in the eye instead of non-selectively targeting arteries and veins. The advantage of targeting just what you need to target to keep the eyes bright and white is that we're able to maintain better oxygen flow to the eye. If you're not sort of squeezing off all the arteries and veins, you can kind of keep oxygen flow happening to the eye, which is healthier long term. So some of the competitors I'm sure you've heard of: Visine, Clear Eyes, Rhoda drops. These are all different types of redness relieving drops that you may or may not have tried. So why do eye doctors not particularly care for that type of drop? Well, it goes back to what I was talking about with the non-selective targeting. Any of those drops are going to non-selectively target and cause all of the blood vessels to shrink, all of them to do so very rapidly. And non-selectively targeting like that causes rebound redness. So after using those drops, you may notice that the redness comes back and it's even worse than it was before. These drops can also be drying to the eyes. And then finally, they do, and Lumify would do this too, but we want you to be careful with the use of redness relieving drops, particularly if you have something going on with your eyes, which stick with me till the end. We're going to talk about some reasons to see your eye doctor when you have red eyes. instead of just using a redness relieving drop like the ones mentioned. So just to sum up, Lumify versus its competitors, eye doctors really prefer Lumify because of its selective targeting of veins and not arteries and veins. We really don't prefer, Visine and Clear Eyes. That tends to be drying to our patients' eyes, potentially irritating, and causes rebound redness, which is not helpful, of course. You're trying to get those eyes bright and white, not end up with more redness than you started with. So let's go into a little bit about Lumify, how to use it, what it's good for, and then we'll get to red eyes in a minute. So in terms of using Lumify, you can use it, I usually recommend starting at twice a day, but it's actually indicated up to 4 times a day to relieve your redness. You're going to want to use Lumify without any contact lenses in your eye. So ideally, if you're wearing contact lenses on a day-to-day basis, you could put Lumify in the morning before you instill your contact lenses, wait a good 5 to 10 minutes, and then you're safe to put your contact lenses in. Again, at the end of the day, you could certainly take your contact lenses out and put the drops in again. If you do have redness throughout the day, the best advice I have is definitely take out your contact lenses and put in the Lumify without any lenses in your eyes, waiting at least 5 to 10 minutes before you put those contact lenses in again. That truly is the safest way for your eyes because contact lenses are like sponges and they're gonna soak up whatever's in those drops. And you really don't want to be exposing yourself to that medicine over and over again in an uncontrolled way like that through a contact lens. It's better to refrain from using any kind of drop over contact lenses. All right, so we'll talk about some uses for Lumify redness relieving drops. You're going to want to use this for just minor irritations, minor redness of your eyes, and not certainly if you have an infection or greater issue going on. So some appropriate uses, I'll give you one example, would be flying on an airplane and then you're going to a conference and you're going to be in all these air-conditioned rooms. That's a perfect time to take a bottle of Lumify with you because it'll relieve that minor irritation. We're not talking about an eye infection or a problem. We're just talking about keeping those eyes white and bright so that you've kind of got your game face on and can go to your conference and network with confidence. Any special occasion certainly would be great to use Lumify for. Your wedding day, your baby shower, your birthday, a night out. These are times you want to look your best. Truly any time you want to look your best. Let's say you're going for an interview and someone's going to be making sustained eye contact with you. Keeping those eyes white and bright may be very important to you. And so Lumify is absolutely perfect for that. And then just in everyday use, you certainly can use these drops just every day for little minor irritations. But let's talk about where that line is because there certainly becomes a point when we're not just relieving minor irritation anymore. There's an underlying problem that truly needs to be treated first. So a couple of those issues include dry eyes, okay? So if you continually feel like something's in your eye or your eyes are dry or they water excessively, you really should see your eye doctor to find out if you might have underlying dryness of your eyes. Another type of redness that can occur is from allergies. So if you tend to have a lot of itching or your eyes get seasonally red, again, we don't want to be covering that up with a redness relieving drop. Definitely see your eye doctor because we have specific allergy treatments that are made for that type of condition that will get at the root of the problem rather than just covering up the redness. So the next type of issue I would want you to be concerned about is an infection, okay? So whether you wear contact lenses or not, any of us can get conjunctivitis, viral or bacterial. And so if you have red eyes that are painful or irritated, if the redness isn't going away, if you have discharge coming from your eyes, whether it be copious and watery or yellow or green, one of those fun colors, if any of that is happening, that could signify that you have a bigger infection going on, and we definitely want you to see an eye doctor for that. So red eyes can be serious, and I never want to encourage you to use a drop to cover up signs and symptoms that might be occurring. So I'm going to give you a helpful acronym. It's RSVP. What that stands for is redness, sensitivity to light, vision changes, or pain. If anything is worsening of RSVP instead of getting better, then that you need to see an eye doctor for that. So think about redness should be mild and resolved completely with Lumify, not getting worse. Sensitivity to light, shouldn't be having sensitivity to light. If that's occurring, that's a pretty good indicator something else is going on. Vision changes, definitely should not be having vision changes with the type of mild irritation and redness that's indicated for Lumify. So if that's occurring, we definitely want to see you for that. And then also pain, again, should not rise above very mild irritation. But if you're having kind of consistent irritation and even pain, you got to see your eye doctor. Not something for Lumify to take care of at that point. Okay, so Lumify does contain BAK or benzalkonium chloride, but the FDA allows up to 0.02% and Lumify has 0.01%, so significantly less than what the FDA allows. I personally haven't seen any side effects of the BAK in my patients, but if you are very sensitive to BAK and that's a known sensitive, chemical for you, then this is a drop you'll want to avoid. A couple of tips for keeping your eyes bright and white. In general, without Lumify, I would recommend getting lots of sleep, drinking plenty of water, taking breaks while you're on a computer. Most of us spend our days staring at computer screens and phones. And so I have a video about the 20-20-20 rule. We'll link that somewhere. And you can certainly take a look at that and some of my other tips for computer use, but those are things that'll keep your eyes bright and white. If you wear makeup, consider changing to one that's made for sensitive eyes. There's a recent makeup on the market called Eyes Are the Story. Eyes Are the Story is excellent. It's wonderful for sensitive eyes. Take a look at the video I made about that right there and consider changing to that. We'll also leave the link in description of where you can get Eyes Are the Story. I hope you enjoyed this video about Lumify and hopefully learned something at iSchool. If you haven't already, make sure to like and subscribe because we'll be here every single Wednesday at 4 o'clock and we will see you next time. All right, I'm just going to address the elephant in the room here. So I know you're wondering if you can use Lumify for random drug tests. Yes, it'll work for that, but don't be doing that. That's not good for you.